Greetings, friends and followers. This is Nurses Talking. I am Dale Barcy, and as always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. So, here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today, I'm very, very pleased to welcome MacKenzie Butler out of Minnesota, USA. So, Mackenzie says that with 10 years of and a doctorate in nursing, she's an energetic and dynamic nursing leader. And she's gone from critical care innovations, and she has a broad range of experience and even built her own consulting business to help transform healthcare. She's passionate about driving change and empowering others, and she continues to reshape nursing. So, welcome, Mackenzie.
Thank you so much, Dale. I'm glad to be here.
Yeah, I love that passion in your bio. You know, nursing is one of those things that you can't be kind of lackadaisical about.
Yeah,
You
that
know?
is so true. I think we can bring that passion into so many different aspects, but I do think that is an underlying tone of all nurses.
Yes, it is. Yes, it is. So why, but why though? Why are you a nurse?
Well, truly, I got into nursing. My mom was a nurse growing up, and that was really my first exposure to it. And when you're a little kid, you just
Yeah.
start like, "Wow, I'm going to be an astronaut or whatever."
Yes,
And so I
yes.
knew roughly what a nurse was, but even as I got older and more exposure to it, I was fascinated by the overlay of principles of both science, but then the humanities and really being with people at their most vulnerable state.
Yeah. So your mom was a nurse, and so you followed in her footsteps. She must have set quite a great example, though. Um,
She really did. She is an incredible nurse. She's stepped away from it now, but she really focused on long-term care, which is a really tough area of nursing, but she loved it. She loved,
mhm.
helping care for people towards the end of their life and transitioning them. And she was very passionate about it and loved the hard work that came with it.
Yeah, yeah, I fully understand that. I understand that. I myself started out, I thought I was a acute care nurse. And for a while, that's exactly what I was. I loved the adrenaline pumping. I loved those areas. And then after I had children, and I thought, okay, well, you know what? I can't maintain this level. I'll try long-term care. And it was supposed to be only temporary. It didn't work out
Yeah.
that way.
Yep. I love it. I love it. But I love what you said there too about like this was what I was, and then you've realized your
Yeah,
passions and interests changed, and you stepped into that. That's
you go into it. Yeah.
amazing.
So, but what challenged you though?
In nursing, what's challenging?
Hmm.
I feel like there's been a lot of challenges, not necessarily. We hear a lot about burnout now, and I think that's kind of a hot buzzword. But I think in a lot of ways, nursing has challenged me to really step into myself in a new way, step into things that maybe made me uncomfortable.
Hmm.
As you mentioned, I'm from Minnesota, and there's this connotation that we're not the best at, I would say, people would say confrontation, but I believe it's, setting boundaries and saying like, no, this doesn't serve me, or
Hmm.
I can't, this doesn't feel right for me. And so being a nurse has really helped me step into a new voice of being able to advocate both for my patients and for myself.
Yeah, yeah. That's one of the things that about this profession is that it teaches you a lot about yourself. It forces you actually to learn about yourself.
Yes, yes. There is this mirror effect, and I have not met many nurses who do not introspect greatly during their career. So I think it is really a beautiful gift, but it does force you to be uncomfortable.
Mhm. Yes, it does. Yes, it does. Yes, it does. And you learn so much from that. So much from that.
Yes.
So you critical care, you talk about critical care to tech innovations. What kind of other areas did you work?
Yeah, I say critical care because that really was my trajectory forward. I worked in a critical care float pool, and coming into critical care, I'm sure many of us are aware that that area of healthcare turns over because it is very intense. So I was working in ICU at night, and I loved helping teach others how to do some of the things that aren't well taught in other areas of nursing. And I would take on, nursing interns or capstone students. So I found myself teaching a lot. All this to say, when I went back for my master's degree, I really realized I loved teaching, but I focused on simulation education because I think there's
Mm,
something really profound about being able to immerse ourselves in the experience and making those high fidelity situations applicable. And that really was what my trajectory, both into education and away from bedside nursing, was stepping into
mm.
that innovation of simulation.
Okay, so simulation is your thing.
Yeah, yeah. Well, it was. I actually don't do simulation anymore, but it was my first dabble into like tech, if that makes sense. But I work in education tech now, so it's kind of an interesting segue.
Education tech. Mm. Okay, that's pretty cool.
Yeah.
That's pretty cool. I was going to ask you how are we leveraging? There's a lot of technology, a lot of stuff coming on board pretty quickly. So how do you think we're leveraging technology to improve patient care?
Technology is such a broad term.
Mm.
There are a lot of pathways I think we as nurses and all of us can look at. I think one of the hot items right now is AI.
Yeah.
So I work in board prep as like my Monday through Friday job.
Hmm.
And we're utilizing AI to help nurses study more effectively for their boards and take some of the extra brain work out of identifying areas of, opportunity or areas where they need more growth and things like that. But I think in a broader sense, why AI is a little like scary for all of us, I think there's a lot of aspects of it that can be really beneficial and help us utilize other parts of our brain more readily when we're not bogged down by all of, kind of like the system work and things like that.
Hmm. Hmm.
But I think technology and nursing really goes hand in hand, and I don't think we're going to see a time where they're not ingrained the way that they are now.
Yeah, yeah, and more so, and much more so all the time. But you mentioned AI. You talked about AI, which brought up something that's very interesting to me, or something I think about, and that has I think it's about responsibility and integrity, especially in the education area of it. So how do you balance that. Yes, this is a great innovative thing that we can use, but how can we use it responsibly? Especially as the outcome is that we're going to be dealing with people's lives.
That is probably the most important question with AI, and it's a line that we're all going to have to toe as we go forward and start utilizing these tools. I think one thing that I use a lot as a gut check is, am I taking away from using my critical thinking lens when I'm using this resource? Because I think AI cannot critically think for us, at least not yet. And I hope that's not something we step into because like I have years of training, experience, and exposure that I
Yeah.
don't think AI can digest in a human way. But I think if I'm using it to key into things or if I'm using it as guide rails, I think that is the precipice of where we could be doing more.
Yeah.
And I think even I don't think people would think about, so like in charting, for example, the hospital system I work for uses Epic, and we get these triggers, right? Like BPAs,
Hmm.
best practice alerts. And it's taking an algorithm essentially of like if your patient's temperature is this, their blood pressure is this,
Yes.
their lab values are this, then it flags for sepsis. Now we have to use our critical thinking to decipher if that is really what's happening, but we're
Yes.
using this artificial intelligence to help bring these things forward, so that they don't get missed. So I think that that is really more what I would love for us to focus on
Hmm.
is helping alleviate some of the human errors, but still utilizing all the knowledge and resources we have.
Yeah. Because at the end of the day, all it's giving you, as it seems, as much as it is very, very helpful, all it really is giving you is data. You still have to utilize that data per patient.
Yes, yes. We have to practice discernment and really
That's the word.
yes,
Mhm.
yes.
That's exactly the word. Yeah. So, what do you think? This is this question that I ask nurses all the time, and a lot of nurses are very sensitive about it. But again, nursing is a very it's an evolutionary um uh it's an evolutionary thing. Career is what I'm looking for. What do you think you'd like to see change?
If I was going to zero in on one thing, and this is like a lens far, far removed, especially now that I've moved from the bedside and kind of have a
Mhm.
different global view, but I think the ownership of nurses in healthcare, I would love to see shift, meaning maybe there's a time where we see a nursing owned hospital or hospital
Yeah,
system rather than just having nurses on the board, have them have stake in it in a new way. So I would love to see this real revolution of healthcare and having nurses again like step into that power of that knowledge base that a lot of us have.
yeah. But and that really is a desirable thing and it's a possibility. But I don't think our mindset is there yet. We haven't, we don't think,
Yes, yes.
I don't think we see, many of us are beginning to see ourselves as entrepreneurs, but not big.
Yeah. Yeah, I don't know if it's this level of maybe we've been told we are this one thing and we've always been
Yes.
put almost into the support role and we are just staff. I hate putting the label
Yeah.
of just on anything, but I'm hoping that in the years to come and as more of us step into seeing like we can be nurses and work in business and we move through our own imposter syndrome
Yes.
that we can really be the revolution that we need in healthcare because I can see on the horizon there has to be a radical transformation.
There has to be. There has to be within us, and that has to be projected out because um the people that we serve, the people that we work with, see us in this lane. And until we get them to see us in a with a wider view, I don't know that it's going to be very difficult for us. I specifically remember many years ago when I took a job I managed a plasmapheresis center.
Cool.
And someone who knew me says, but that's not what you were trained to do, very indignantly. And I was like, but you're not a nurse. How do you know what I was trained to do?
Yes, yes. I'm seeing this like theme too in other like interactions and socials with nurses is that I don't think we leverage our education or we
No, we
don't
don't.
see it. And we have so much education. Like we do an insane amount of exams and exposure and clinical hours, and there are endless
Yeah.
potential of, different nursing roles. I'm sure as you've seen as you've
Yeah.
interviewed people, no two nurses are the same, but for whatever reason, we put our own selves in this box. Uh,
Yeah.
and it really is time to start opening that up and realizing like we are more than just
Yeah.
nurses.
Yeah. Yeah. We see ourselves as some kind of monolithic thing. If we're not. Anyway. So you've done all this. What would you say? I've begun asking you this because I begin to understand, I begin to believe we have just not the nurse superpower, but the individual nurse superpower. What is your superpower?
Truly, I have found my superpower is authenticity, and that probably sounds silly or a little bit of um, it's a little bit of a dog whistle right now of people trying to find an authenticity, but I have always felt that I show up as myself, and I've stepped into that more as I've gotten older and more experienced. But I love that I can truly be myself and not
Yes.
be so edited to fit what I think other people need me to be. And that has opened up more authentic relationships with my patients, with my colleagues. And being honest with ourselves is part of breaking down that imposter syndrome, I
Yes, it
think.
is. Yes, it is. Yes, it is. We have to show up as ourselves. And we're fortunate in a way because we're nurses. We're in a profession that actually teaches you so much about yourself. You really now have to show up that way. What advice then you think you give to somebody who wants to be a nurse?
The advice I've been giving lately is not to be afraid to change. Yes, you might go into this one career, or I remember when I came out of nursing school, I was like, I will never work in ICU. I want my patients to talk to me, or I want to be able to have these real human interactions with them. But then I found working in the ICU is one of my most profound and really the springboard to where I am now. And so
Hmm.
I never say never, try all the things. It's okay to switch jobs. It's okay to experience different things. It's okay to step into something and realize like maybe it's not for you. That's okay. Like that's the best thing, is to realize what is and is not for you. And that's in any relationship. Your job is essentially a relationship you have,
Hmm.
and you might
Yeah,
outgrow it, and that's
yeah,
okay.
yeah, yeah, yeah. And gone are the days, and I really hope they're gone, when people looked at your resume and think and say, actually, well, why have you had so many jobs? Why have you moved? I hope those days are gone.
Me too. Me too. That is so arbitrary. And really, it should be a skill set to see people who've experienced so much and have been,
Exactly.
empowered to try new things. And then they can bring that to the next role. So
They
I
bring that to the next role. Yes, yes. But very often people, I believe, still and very used to see it as a weakness, a sign of instability, a sign of all kinds of other things. When in fact, you're trying to find your niche,
yes, yes.
working your way to the thing that is waiting for you.
You're right. Let's sign the petition right now, Dale. Let's be done with
Okay,
it.
good.
Done.
Okay, good. That works for me. So, you mentioned earlier, though, you talked about burnout earlier. And of course, we say that a lot of that is due to, I think that a lot of that also um, is due to lack of self-care. Yes, those external things are there. The shortage of staff is there, the politics are there, and all of that is there. But I think that a good bit of it is due to a lack of self-care. So, what does self-care mean to you?
For me, in my personality type, I truly have to be a steward of my calendar and my time. And that sounds so
Mhm.
silly, but I do a lot of things, as far as, I work my regular job and I do coaching for nurses and I'm still an educator, but that takes a lot of accountability to my time and my calendar. And I can't negate the fact that I have a supportive partner who's really thoughtful, and intentional with, helping support and,
Mhm.
allowing space for fluctuations in our time and calendar. So all of
Oh,
this to say, I think self-care is really about building a life around joy. So I am sure to build time into my calendar for rest, for doing things that fill my cup. Like I went and got a pedicure with my goddaughter and two friends the other afternoon. And I was
mhm.
like, this is great. This refills me so I can
Yes.
continue to pour out into the universe. So
Yeah, yeah, yeah. And that comes back to sometimes what we talked about right at the very beginning about knowing yourself. Actually, because very often I realize we don't even haven't taken the time to figure what it means to us to take care of us. Because it's not the same. It is absolutely not the same for everyone. I can take 5 minutes outside in my garden and be totally good. And all I had was 5 minutes, and be totally good. And that might not be the same for, as a matter of fact, I know someone fairly close to me for whom that would not be the same because she doesn't like the little bugs running around.
yes, yes. And it brings us back to like we need to introspect as people and
Yes,
really be, so honest with ourselves and like sit in our body of what is it that energizes us and what drains our energy. And for whatever reason, I feel like people just don't sit with themselves.
we don't. And that's one of the reasons I asked that question, what does it mean to you? Because we really have to understand that I don't think we even see ourselves sometimes as people. you know, we see our patients and whatever, and we have learned to see the whole person. And I don't know if we all always see ourselves as a whole person, address all our little spiritual and physical and mental needs and all of that. I'll go along. I can do this. I can push through. I'm tough. I'm a nurse. I can push through.
Yes, yeah, it's really been baked into the culture that we are essentially a second-class citizen to
Hmm.
everyone else around us,
Yes.
rather than putting us back at the center, and allowing us to be the main character. It is very okay for us as nurses to be the main character, as long as we like maintain that holistic relationship with our patients. I think it's actually better if we
It's better.
center
Yes.
ourselves. Yeah,
Yeah, because you show up more complete.
yeah.
You show up more complete. Mackenzie, I cannot tell you how much I've enjoyed talking to you. Any last words you want to leave us with?
Oh, goodness. Well, I think as a whole, I just really want people to think about what it is that fills their energy right now, where they are. And that's okay if it shifts, but
Mhm.
just to sit with that and allow yourself to be the main character of your life. I think that that really is a beautiful gift that we should be giving to ourselves.
Yeah, yeah, yeah. And I really wish and hope that we could recognize that early. Um, if you're into theater, it's a play and you're the star.
Yes, yes. I love that. I love that. Well, thank you so much for your time today, Dale. It was a pleasure.
It is my absolute pleasure to have you, Mackenzie. Thank you very much. Bye bye.